What is the correct compression to ventilation ratio for adult CPR by a single rescuer? A. 15:2. B. 30:2. C. 5:1. D. 10:2. Answer B. When performing adult CPR alone, the ratio of compressions to breaths is 30:2. What is the recommended depth of chest compressions for an adult? A. At least 1 inch. B. At least 1.5 inches. C. At least 2 inches. D. Exactly 3 inches. Answer C. Adult chest compressions should be at least 2 inches deep but not more than 2.4 inches. What is the first step in the BLS assessment? A. Open the airway. B. Give compressions. C. Check responsiveness. D. Call 911. Answer C. Always check the person's responsiveness before initiating any further steps. How often should you switch roles during rescuer CPR for adults? A. Every 1 minute. B. Every 2 minutes. C. Every 5 minutes. D. After every 10 compressions. Answer B. Rescuers should switch roles every 2 minutes to prevent fatigue and ensure high-quality compressions. Where should your hands be placed during chest compressions on an adult? A. On the upper abdomen. B. Lower half of the breastbone. C. Center of the neck. D. On the left side of the chest. Answer B. Hands should be placed on the lower half of the sternum in the center of the chest. What is the recommended compression rate for all age groups? A. 60 to 80 per minute. B. 80 to 100 per minute. C. 100 to 120 per minute. D. 120 to 140 per minute. Answer C. Chest compressions should be delivered at a rate of 100 to 120 per minute. What action should be taken if the AED advises no shock? A. Deliver a shock anyway. B. Turn off the AED. C. Resume CPR immediately. D. Wait for another analysis. Answer C. If no shock is advised, resume CPR starting with chest compressions. How many breaths should be given during adult rescue breathing without compressions? A. 1 breath every 3 seconds. B. 2 breaths every 10 seconds. C. 1 breath every 5 to 6 seconds. D. 10 breaths per minute. Answer C. When performing rescue breathing for an adult, deliver 1 breath every 5 to 6 seconds. How should you open the airway in a victim without suspected spinal injury? A. Chin lift only. B. Head tilt, chin lift. C. Jaw thrust. D. Neck hyperextension. Answer B. Use the head tilt, chin lift maneuver to open the airway unless spinal injury is suspected. What should you do if a victim has a pulse but is not breathing? A. Start compressions. B. Do nothing. C. Begin rescue breathing. D. Give abdominal thrusts. Answer C. If the person has a pulse but is not breathing, begin rescue breathing immediately. What is the compression to ventilation ratio for a rescuer child CPR? A. 30:2. B. 15:2. C. 20:2. D. 10:1. Answer B. For children, 2 rescuers should perform compressions and ventilations at a 15:2 ratio. For infant CPR by 1 rescuer, what is the correct compression technique? A. 2 thumbs encircling chest. B. 2 fingers just below nipple line. C. Palm of 1 hand. D. Full body compression. Answer B. Use 2 fingers to deliver compressions just below the nipple line for infants if you're the only rescuer. Which of the following is an effective method to minimize interruptions during CPR? A. Pause between compressions. B. Rotate rescuers slowly. C. Pre-charge the AED during compressions. D. Stop CPR to discuss the plan. Answer C. Pre-charging the AED while compressions continue helps minimize pauses in CPR. How long should you check for breathing and pulse? A. 1 second. B. At least 15 seconds. C. No more than 10 seconds. D. Until AED arrives. Answer C. Breathing and pulse checks should take no more than 10 seconds. What is the proper hand position during 2 rescuer infant CPR? A. 1 hand on chest. B. 2 fingers only. C. 2 thumbs encircling technique. D. Elbows pressing on chest. Answer C. In 2 rescuer infant CPR, use the 2 thumb encircling hands technique for better compression depth and control. What is the correct depth of compressions for a child? A. About 1 inch. B. About 1.5 inches. C. About 2 inches or 1/3 the chest depth. D. At least 3 inches. Answer C. Child chest compressions should be approximately 2 inches or 1/3 the chest depth. What should you do after delivering a shock with an AED? A. Check for a pulse. B. Wait 30 seconds. C. Resume CPR immediately. D. Give a rescue breath. Answer C. After delivering a shock, resume chest compressions immediately without checking for a pulse. If a choking adult becomes unresponsive, what is your next step? A. Deliver abdominal thrusts. B. Perform finger sweep. C. Begin CPR, starting with compressions. D. Call for help only. Answer C. If an adult who is choking becomes unresponsive, start CPR beginning with chest compressions. When performing CPR on an adult with an advanced airway, what is the correct ventilation rate? A. 1 breath every 10 seconds. B. 1 breath every 6 seconds. C. 10 breaths per minute. D. 2 breaths per compression cycle. Answer B. When an advanced airway is in place, provide 1 breath every 6 seconds while continuous compressions are given. How can you ensure effective chest compressions? A. Compress faster than 140 per minute. B. Let the chest recoil fully. C. Compress over the ribs. D. Keep elbows bent. Answer B. Full chest recoil between compressions allows the heart to refill with blood and improves effectiveness. What is the correct rate for giving breaths to an infant during rescue breathing? A. 1 breath every 3 to 5 seconds. B. 1 breath every 10 seconds. C. 20 breaths per minute. D. 2 breaths per cycle. Answer A. Infants require 1 breath every 3 to 5 seconds during rescue breathing. What is the most reliable indicator of effective CPR? A. Audible breathing sounds. B. Change in skin color. C. Chest rising with compressions. D. Presence of a carotid pulse during compressions. Answer D. The appearance of a carotid pulse during compressions shows that blood is circulating effectively. What is the best way to relieve choking in a responsive adult? A. Back slaps. B. CPR. C. Abdominal thrusts. D. Rescue breathing. Answer C. Abdominal thrusts, Heimlich maneuver, are recommended for relieving airway obstruction in responsive adults. What is the compression to ventilation ratio for infant CPR by one rescuer? A. 30:2. B. 15:2. C. 20:2. D. 5:1. Answer A. For a single rescuer performing infant CPR, the correct ratio is 30:2. When performing mouth-to-mask ventilation, how should you position the mask? A. Over the nose only. B. Over the mouth only. C. Cover both nose and mouth. D. Under the chin. Answer C. The mask must seal over both the nose and mouth to provide effective ventilation.